the veterinarians do feel that we need to be engaged in the discussion regarding antimicrobial resistance and the transmission of resistance. So part of what we kind of use to support the rationale behind being so engaged in these different discussions is this. Veterinarians are really the ones that are most knowledgeable about zoonotic diseases, transmission between animals and humans, and so forth. So we believe that that is the reason why we are the only health profession that has a differing perspective on resistance from some of the other health professions. So AVMA has a couple of policies that outline the role of the veterinarian. One specifically saying that veterinarians should be involved in the decision-making process for the use of antimicrobials regardless of the distribution channels through which they were obtained. The part about distribution channels is essentially referring to over-the-counter or VFD or prescription or what have you. That's just regardless of how you get the drugs, a veterinarian should be involved. And FDA agrees with this. It was put in their Guidance for Industry number 209, which outlines their thought process for more judicious use of antimicrobials. And then we also have our AVMA judicious use policy and species-specific policies that are done in conjunction with our species-specific allied organizations. And within our judicious use policy, again, we say that veterinarians should be involved in this process. So at the core of greater veterinary oversight is the VCPR. And some of you might recall last year I talked about the VCPR as well. It's sort of been in a constant state of flux and it's kind of confusing. So I'm going to try to make it as simple as possible, but it is fairly confusing. So the VCPR is the basis for interaction among veterinarians' clients and their patients. The current iteration of the VCPR from AVMA has a couple of different components to it. The veterinarian provides oversight of treatment, compliance, and outcome, and patient records are maintained. Those two parts are new to the VCPR as AVMA has it. So this is the part that's kind of confusing. So where does the VCPR live? Well, at the AVMA, it lives in the Model Veterinary Practice Act and in our Principles of Veterinary Medical Ethics. At FDA, it lives in AMDUCA and in the current regs for the VFD. So AMDUCA is for extra-label drug use. In the new VFD, as its proposed draft text has been written, there is no requirement for the VCPR. Now, there are two different VCPRs now. There's this one that's in AMDUCA. We are calling it the federal definition for VCPR, or the AMDUCA VCPR, specific to extra-label drug use only. For everything else, we go to AVMA's Model Veterinary Practice Act and the PVME, which encompasses those new components that I just talked about, the veterinary oversight of treatment, compliance, and outcome, and the requirement for patient records. Sort of in the middle here, we've got State Practice Act. I think my pointer's not looking at it. Yeah. Anyways, so in the State Practice Acts, individual states can have their own definition of VCPR. We are encouraging that they adopt AVMA's Model Veterinary Practice Act and the VCPR contained within, but it may or may not actually happen. So there are a lot of VCPRs floating about. This is just an overview of AMDUCA, and again, what is in AMDUCA for extra-label drug use to pay attention to. It says that the veterinarian has recently seen and is personally acquainted with keeping care of the animals by virtue of examination, and timely visits to the premises. So the new version does not say premises anymore for AVMA's version of the VCPR. In the Model Practice Act, there are also commentaries that allow sufficient knowledge to be supplemented by examination of production records, consultation with owners, and info regarding the local epidemiology of diseases. These changes to the VCPR were actually there purposefully to allow more flexibility for large animal operations. And if you recall, in the original version here, it says to the premises. In the new version, it says to the operation. So within an operation, you could have several geographic locations. So that's less limiting to the veterinarian. So the thought process here with the current VCPR by AVMA is to allow for more flexibility for the veterinarian. This is an overview of that commentary again. So now in our Principles of Veterinary Medical Ethics, we are in the process of harmonizing all of our documents so they all contain the same AVMA, VCPR, and the VCPR is currently in the Principles of Veterinary Medical Ethics and should be changed so that it includes the phrase about oversight of treatment, compliance, and outcome, and also so that it no longer says premises but says operation. So now I kind of get to prescription requirements. In MDUCA, it says that essentially anything under MDUCA has to be within a VCPR. And that's why we have the VCPR definition that is in MDUCA. Again, FDA and MDUCA's definition of VCPR. In the Animal Drug Availability Act in 1996, we established the VFD. Now, in the VFD, it does not necessarily refer to a VCPR, and that's why the new language for VFDs does not require a VCPR anymore. What it does require is essentially that you be a licensed veterinarian, and it shall be issued only by a licensed vet in the course of veterinarian's professional practice. And licensed does mean licensed in the state in which you are practicing, where those animals reside. So that is the current interpretation of licensed veterinarian. So current Federal Register verbiage on VCPRs and VFDs. There is the current regs for the VFD and then the draft text for proposed VFDs that came out, I think, a little bit less than a year ago. And so that is a process that is still underway. That draft text should be published, I would guess, as a proposed rule in maybe 6 months or so. And I'll get to why in just a minute. Oh, I forgot I put this in here. Anyways, so VCPR in the current regs. And now it just says in the course of a veterinarian's professional practice. And that's what it will say for anything that now becomes VFD. And as I'm sure most of you know, we do have things that are going from over-the-counter to VFD in accordance with GFI 213. So next, we may see some changes in the State Practice Acts regarding VFDs or the VCPR. Again, we're changing AVMA's policies so that they are all harmonized with our VCPR. And then there is talk of having species-specific BMPs, best management practices, and so forth, because we do recognize that the interactions between the veterinarian, the client, and the patient are different from species to species and different commodity groups. The prescription requirements for prescriptions, and that would be, say, anything that's in water for livestock would go to prescription status. That was established in 1988. And so it will contain that verbiage where it says, federal law restricts this drug to use by or on the order of a licensed veterinarian. And then the second thing that you see down there is relevant to VFDs now. So how did that work with producers? I think we're all of a common understanding that it is important to have veterinarians involved in this process. We have it outlined in a lot of our different policies, including the judicious use policy, and certainly within a lot of our policies and different positions, we recognize the importance of working very closely with producers. So AVMA efforts, like I said before, we have this policy that sort of drove the involvement with FDA on VFDs and greater veterinary oversight, and it was essentially that AVMA believes that we should be at the forefront of these discussions. And so from that, we've had numerous task forces and steering committees. Currently, we have the AVMA Steering Committee for FDA Policy on Veterinary Oversight of Antimicrobials, the longest name ever, and we've been calling it the VOSC, Veterinary Oversight Steering Committee. And they are actually still active. They are still working with the FDA to essentially kind of get a head start on what FDA is doing before it comes out in black and white in the Federal Register. And we found that to be very effective. A lot of the things that the steering committee had recommended did wind up in the draft text before it was published. So I think this is just kind of an overview of what that steering committee has done previously, as I just said. And they do agree that the VFD is really the only vehicle that the agency has to have greater veterinary oversight of antimicrobials in feed. So we are working with them on that. I don't know how many of you are aware, but the FDA has organized 5 listening sessions around the country. One took place last week in Bowling Green, Kentucky. The next is next week in Olympia, Washington. And essentially the purpose is to hear the concerns of the different stakeholders. I encourage you, if you have the opportunity to go to any of these listening sessions, please do, and provide your input on the implementation of the VFDs. Is there a question or something?
How were those sites chosen, Christine, do you know? They seem kind of obviously not in animal production areas.
You know, I've heard that a lot. I think part of the thought process, and it was really arranged by FDA and USDA together, so part of the thought process is that there have been a lot of concerns about the veterinary shortage as this new rule is implemented. And so I'm not sure if the thought was, well, we'll pick some really remote locations where there is a veterinary shortage, but then again, it doesn't necessarily correlate with animal production. So there may have been a little bit of a disconnect on that. But certainly there is opportunity for comment, even if you don't attend one of these listening sessions. The Federal Register notice is open for comment for 60 days after the last meeting, and the last meeting is scheduled sometime the first week of June. So, you know, basically early August, you can still submit comments on it. And then, so moving along to legislation that's in play, there's PAMTA. We've all seen PAMTA for many, many years now, the Preservation of Antibiotics for Medical Treatment Act. The DATA Act essentially is to amend reporting requirements for the use of antimicrobials, and then ADUFA. ADUFA actually is not particularly related to antimicrobial resistance, but oddly, there has been some motivations to insert language related to antimicrobial use in that. So that's why I'm going over it. So PAMTA. So the latest version of PAMTA does have a couple of changes from its previous iterations. One of them being that it includes cephalosporins now. And then, according to Slaughter's office, who introduced PAMTA, it is to ensure that any use of medically important antibiotics outside of treatment of a sick animal is not permitted. So keep that in mind. So anything outside of treatment of a sick animal is not permitted. But then there are a lot of very confusing definitions within the context of the legislation. Therapeutic use is defined as treating an animal with a documented disease or infection. Okay, I get that. I think that makes sense. Non-therapeutic use is through feed and water, or if in a poultry hatchery, it's any mechanism of administering antibiotics, which I think is a little strange there, for purposes other than therapeutic use or non-routine disease control. It also says anything that is repeated or a regular pattern of use other than therapeutic or non-routine disease control. And then further down, it defines non-routine disease control, and it says an animal that isn't sick, but it can be shown that a particular disease or infection is present or likely to occur because of a specific non-customary situation. And then you go to the non-customary situation definition, and it says does not include normal or standard practice conditions on the premises that facilitate transmission of disease. So, make a lot of sense to anyone, because I, as a veterinarian, am not unclear of what all of this really means. The new terms are very difficult to follow. I think it's a little difficult to figure out how exactly these might be implemented. Some of it is, well, if you look at the non-routine disease control, it kind of says you could probably use it for, let's say, a control situation, because it says not sick, but a disease is present. So, you know, if it's present in the barn, I think that is just kind of control. But then it talks about what's non-routine, and we often ask, well, what is routine anyways in a production practice? I mean, isn't everything fairly routine? You know what kind of animals are coming. You know the disease that is present there in that system, where you're moving it to. There's an awful lot that we know, and the whole production process, I believe, is fairly routine. So that is confusing. And then, of course, we don't really know what standard practices and conditions it's referring to that facilitate the transmission of disease. Transmission of disease will occur regardless of whether or not we're facilitating it per se. So since none of that is really defined, this gets very, very confusing. AVMA has not taken an official position on this version of PAMTA because it has to go through our processes of all of our councils and committees and that sort of thing. But previous iterations of PAMTA we have not supported, and we've been in active pursuit of defeat, which means we actually expend a lot of AVMA resources opposing that particular legislation. And then, it also has prohibitions based on this non-routine disease control. And allowances for when you could use drugs in feed for non-routine disease control. And I'm still having a hard time wrapping my mind around that, which is why I keep repeating it. But one of the things is a significant risk that a disease or infection is present on the premises. Well, I think that's one of the times that we use it regularly. I mean, you wouldn't give antibiotics to an animal unless there was a disease risk present. So that's kind of intuitive to us anyways. And then, it's necessary to prevent or reduce the risk of transmission. Again, sort of a prevention thing that we do currently and we believe is perfectly appropriate. And then for the shortest duration possible, at a scale no greater than necessary, essentially. And so, I think those are concepts that are all employed by veterinarians currently within our judicious use policies and just as a standard of practice almost. So enough about PAMTA. Now there's the Data Act. And the Data Act is for enhanced reporting requirements, expand and coordinate collection of data on the use of antimicrobials in food-producing species. It requires a final version of Draft Guidance 213 to be published within a certain period of time, and then conducts a study evaluating the different voluntary approaches and the effectiveness of data collection. Certainly it is appropriate to try to find out everything that we can find out about the transmission of antibiotics, and so it is helpful to have information collected. However, if you actually look at the Data Act, it too, like PAMTA, is a bit difficult to follow. It's kind of confusing. You really don't know how or if it can even actually be implemented given the current systems that we have. So again, we haven't taken a position on this particular piece of legislation, but there are a lot of questions about it. As a whole, AVMA is not opposed to research and further data collection in general, but it's a matter of, how's that data going to be interpreted, how is it going to be used, and so on. ADUFA, again, I only mention ADUFA because ADUFA 2 is scheduled to sunset in September 2013 and will be reauthorized this year. And so since it's a piece of legislation that is actually moving, there is talk of attaching other things to it, like reporting requirements and collection requirements. There was some proposed language that I've seen that is similar to the Data Act, essentially asking for further data collection and so on. The AVMA is opposed to anything being attached to ADUFA because it could just basically kill the whole piece of legislation. And also, we really just don't think it's an appropriate vehicle for getting more data or interpretation of data and so forth. So it's really just not appropriate in our minds.